We recall that many unscientific medicines were produced as to test whether it can cure the pandemic. The COVID-19 said to have effects on the virus but was not scientifically proven by WHO. However, Dr. Tedros, Director General of the World Health Organization, outlines that the COVID-19 vaccines are on its final trial phase to test its effectiveness against coronavirus.
With global COVID-19 cases rising, Europe is witnessing a second wave of the virus, which prompted a lockdown in some countries as a step to contain the spread of the virus. Many tried cures to eradicate the pandemic, like the COVID organic, Malagasy from Madagascar, and the Russian vaccine, which were not approved by the WHO as they were not scientifically proven to cure the virus. The WHO Director General Ghebreyesus says there is hope at the end of the hurdles. Several COVID-19 vaccines will soon be available in the effective fight against the pandemic.
And there is light at the end of the tunnel. As well as rapid tests and dexamethasone, several vaccines are now in final phase 3 trials. If proved safe and effective, they will be rolled out through the ACT Accelerator's vaccine arm, the COVAX facility, which is now supported by 186 countries. I thank Lebanon and Botswana for joining recently.
As the pandemic caught countries unprepared, Director General Ghebreyesus calls on world leaders to stop politicizing the pandemic and invest in their health systems.
Governments should focus on tackling the virus and avoid politicization. No matter where they are in terms of the outbreak, they should keep investing in the health system and workforce and improving testing, tracing, and treatment of all cases.
Meanwhile, Dr. Michael Ryan, the Executive Director of WHO Emergencies Program, says no country should be blamed as many of them got the virus unaware. He further adds that the globe should learn from the first wave and the impact it had on the people.
Some countries got disease early without the knowledge we have now. So we should not judge individual countries. In that sense, the real judgments don't come in the first wave of any epidemic because nobody has all the information. The question is right now, we have seen this wave pass over the earth. We have seen approaching 50 million people infected, confirmed. We're seeing over 1 million deaths. The question is, are we willing to apply the learning? Many people have paid a heavy price. Have we learned? Yes, we have.
The virus has reached a second wave in European countries as lockdown measures have been imposed to contain it from further spread. Many world leaders said they are prepared for the second wave should it enter their countries again. Globally, there are 45.5 million people infected with the virus, with 1.19 million deaths and 30.6 million recoveries. For iAfrica News, I am Mariama Cham.